From the CDC's most recent version of disinfection and sterilization guidelines, you may be surprised to learn that guidelines for stethoscope disinfection in their entirety read, ensure disinfection when visibly soiled on a regular basis, such as after each patient or once daily or once weekly. These recommendations are too brief, too vague, and ultimately inadequate for addressing disinfection for a vector of transmission that is virtually as dangerous as unwashed hands. The literature is consistent. Dozens of studies in recent years have identified the stethoscope diaphragm as a dangerous vector. With similar density and diversity of pathogens as the clinician's fingertips, and touching patients as frequently, the stethoscope is commonly referred to as the clinician's third hand. So let's address the first issue with the CDC's Stethoscope Hygiene Guidelines by looking at their first recommendation. Ensure disinfected when visibly soiled. Pathogens are microscopic and will never be visible to the naked eye. To wait until the diaphragm is visibly soiled welcomes the transmission of dangerous pathogens from patient to patient for days or even weeks. In addition to this, the guidelines are vague in recommending multiple intervals for cleaning, two of which should be unacceptable. Can you imagine if the hand hygiene guidelines suggested washing hands either once daily or once weekly? Stethoscope hygiene guidelines must be elevated to a level of current evidence by requiring stethoscope hygiene between every patient encounter. Only this will mitigate the transmission of pathogens. The CDC is a national health agency dedicated to improving public health. Stethoscope contamination is an unchecked contributor to healthcare-associated infection. Let your voice be heard by following the link in the description and ask the CDC to elevate stethoscope hygiene requirements today.